Hey guys, so for this video I'm going to talk about how to go through an upper extremity neurological assessment. So just like any other extremity, so like the lower leg for a neurological assessment, you'd run through dermatomes, myotomes, and deep tendon reflexes. So for the upper extremity, one that you would run through is C5. So for the dermatome, that would be the deltoid patch. So you'd have the patient close their eyes, and you would assess bilaterally, so run your fingers over and everything. Ask them if it feels the same. If it doesn't feel the same, they might have some numbness or tingling, might increase with touch and stuff. They could have a nerve issue. So after that, then you would move through to myotomes. So for this one, you'd be assessing shoulder abduction. So you make sure the patient can go through the motion on their own. Then once you have them up, you can assess at the same time for this one. So you'd have them abduct their shoulders, and you basically be performing a break test. So you explain to them, "Don't let me break you out," and then you'd apply mild, moderate, max resistance, and any decreased strength could indicate a nerve injury also. Like I said, test bilaterally. And then you would assess the deep tendon reflex. So for this one, it's the biceps tendon. So you would take a reflex hammer, have the patient properly exposed, seated, elbow slightly flexed, relaxed, and you take the reflex hammer, you want to hit it as close or right on to the biceps tendon as you can, and you want to note any reflex. Lack of reflex or no reflex would indicate possible nerve injury also. A normal reflex would be graded as a 2 on the reflex grading scale. And then, so if they have any decreased strength or decreased reflex or increased neurological symptoms with the dermatome assessment, it could indicate a nerve injury like compressed nerve, any impingement, nerve lesion, or rupture of the nerve. Excuse me. And then another one that you could assess would be C7. So for this dermatome, it would be the middle finger. I'm not going to flip you off, just test bilaterally, note any numbness, tingling, increase. Then for the myotome, you would assess its elbow extension and wrist flexion. So just like for this one, it would be a break test. So test bilaterally, explain to them, "Don't let me break you out," note any decrease in strength or anything. And then you would assess the deep tendon reflex for this one. So that would be the triceps. So you want to have their elbow bent. I know when we practice this one, we bring their arm through our arm, and we hit it with the reflex hammer right on the triceps tendon. Note any reflex or decrease in reflex. Like I said before, normal reflex would be graded as a 2 on the grading scale. And if they're having any issues, so decreased strength, decreased reflex, or numbness and tingling with the dermatome assessment, could indicate a nerve injury like compression, an impingement, a rupture or lesion of the nerve. So that is how you would run through an upper extremity neurological assessment.